Well, the Democratic Republic of Congo says an Ebola outbreak has entered a new phase after a case of the virus was detected in a city with 1 million people. Since April, the virus has reportedly killed 23 people in an isolated area in the northwest of the country. In the meantime, Kinshasa received the first batch of over 4,000 Ebola vaccines to try to prevent its spread. Now, the experimental vaccine was first tested in West Africa during the biggest ever outbreak of Ebola that killed over 11,000 people in a 2-year period. Well, for more, let's speak to Tarik Jašarević. He is the spokesman for the World Health Organization. He joins us now live. Thanks so much for speaking to us. First of all, the fact that it is now broken out, at least one case, I should say, in a city of 1 million people, how frightening is that?
Well, it is definitely a concerning development. We know from experience that it is always more difficult to contain the outbreak in urban areas. What we try now to do is to get teams as fast as possible on the ground to try really to do active case search and also to see who from the community could have been exposed to the virus. It is really a race against time to get to know who were people that could have been in contact with this case that have been confirmed as Ebola case, and who has epidemiological link to previous cases in Bikoro area that is some 150 kilometers away from Bandaka, that is regional capital of Equatorial Province.
And how much hope are you holding out now for those 4,000 or so Ebola vaccines that are now being distributed in the DRC?
So yesterday, the initial 4,300 doses arrived to Kinshasa. We are sending additional 4,000 in coming days, and we have more vaccines available if necessary. So we hope to start vaccinating as soon as possible eligible people, so basically people who are considered to be a high risk, and that's contacts, health workers and responders. What is really important to say is that vaccination is not a magic bullet. Doing vaccination against Ebola does not mean that we do not have to do all the other necessary measures, such as having treatment centers, having contact tracing program, having program for safe burials, having laboratory capacity. In fact, in order to be able to vaccinate people, we need to know who should receive this vaccine, and this entails a big epidemiological work that our teams are doing right now in support to the Ministry of Health and other partners.
Very quickly, though, I mean, over 11,000 people died between 2014 and 2016 in West Africa. Do you feel that enough lessons were learned via that devastating outbreak to be able to treat and conquer this one now in the DRC?
Well, a number of lessons have been learned, but Ebola is known not only from 2014, but from before. This is a 9th outbreak in Democratic Republic of the Congo, and obviously there are a number of differences between DR Congo and West African countries. But what is really important right now is to provide timely and robust response to get quickly to all affected areas, understand where virus may have been circulating, put in place all those necessary measures, have treatment centers to help people get treated if needed, have contact tracing, safe burials, have laboratory capacity, and also vaccinate. So vaccination came as additional tool to all those measures that we know are necessary to fight this disease.
Okay. Tarik Jašarević, thank you so much for joining us there from Geneva.